until vitrification came along. This is an ultra-fast freezing method in which an embryologist practically plunges the oocytes directly into liquid nitrogen. This instant cooling results in solidification of the ooplasma, turning it into a glass-like structure, thereby preventing the possibility of ice crystal formation. So theoretically, this should work. Is there any proof? The proof that vitrification is better than slow freezing for oocytes came from this prospective randomized study published in the year 2010. And then in this study, the authors randomized the eggs into either slow freezing or vitrification, and subsequently warned them for IVF treatments. The result showed that vitrification was superior to slow freezing in all aspects, including oocyte survival on thawing, the fertilization rate, embryo cleavage rate, and subsequently the clinical pregnancy rate. Yes, so vitrification is better than slow freezing. But what about when vitrified embryos are compared to vitrified oocytes are compared to fresh oocytes? Are they just as good? The answer to this question can be found in another randomized control study published in the same year. In this study, this is a very large study involving almost 600 patients, more than 6,000 eggs. And in this study, women who are there to receive egg donation were randomly assigned to either receiving fresh oocytes from a donor or vitrified oocytes from the egg bank. And when the ongoing pregnancy rate between the two groups were compared, they were just the same. So from this study, we can conclude that vitrified oocytes are just as good as fresh oocytes when their pregnancy outcome was compared. What about safety? Earlier on, we talked about the problem with the meiotic spindle and the higher risk of having aneuploid embryos as a result of ice crystal formation from slow freezing method. But is this still a problem with the new vitrification method? There's some evidence to say that this is not the issue anymore, apparently. When we look at the risk or the rate of aneuploid embryos derived from frozen oocytes, when we compare this rate to embryos derived from fresh oocytes, there seems to be no difference. And when we look at infants born from vitrified oocytes, we look at the risk of them having congenital abnormalities and compare this risk to infants born from fresh IVF using fresh oocytes. There was no difference again. And also the risk was comparable to that of the general population. Although these studies are limited in their scope because of the small number of embryos studied and the relative small number of infants followed up, but these initial short-term data appear to be reassuring. So when a woman comes to freeze an egg, what does it involve? The egg freezing cycle starts when a woman gets a period, either as a spontaneous period or one that is induced by the use of birth control pills. Then at that point, we give the woman ovarian stimulation by means of injecting FSH hormone. The woman has to take the hormone injection for around 10 days. And during this period of time, she needs regular scans to monitor the follicular growth. When the follicles are considered as big enough, we give the woman an ovulation trigger. Nowadays, we almost exclusively use a GnRH analog so as to minimize the chance of a woman having ovarian hyperstimulation syndrome. 36 hours later, a transvaginal ultrasound-guided oocyte retrieval will be performed. And when we have gotten the eggs, we freeze them and put them away for storage.